The Canadian Union of Public Employees that represents nurses across the province says violence against hospital workers has always been an issue, but the pandemic has made it significantly worse.
66% of the nurses that we represent report a significant increase in the level of violence they are experiencing during the pandemic, and that 87% of them are thinking about leaving.
Those numbers came from a recent survey of over 2,500 nurses working in major hospitals in Ontario. Over 700 nurses in Hamilton were polled, and CUPE says 78% reported an increase in violence against them or their coworkers since the pandemic began.
They are literally terrified. They go into the work under the conditions where they don't know if they're going to have a coworker with them, and whether they're going to be having to take care of patients on their own.
The unions were at the bargaining table with the province and the Ontario Hospital Association earlier this year, asking for more nurses, protection against working alone, and creating a better system to flag potentially violent patients. But they say the talks broke down last month. In a statement, the OHA says it's been working to find mutually agreeable solutions during the bargaining process, and that while work performed by healthcare providers is often challenging, acts of violence are never accepted as something staff members should expect to face. The union attributes a lot of these issues to a shortage of nurses seen across the province.
We have a severe staffing crisis. Many of them are speaking with their feet. They're leaving, which is causing our hospital system to be broken.
According to the same poll, 90% of Hamilton nurses considered leaving their job at some point during the pandemic.
These frontline workers are burnt out, they're exhausted physically, mentally. Many of them are suffering from PTSD.
It is the workloads that are double, sometimes even triple than what usually they had. It is the violence that they experience from patients, families, mainly, that think that they can take their own frustration on nurses.
Doris Grinspun from the Registered Nurses Association of Ontario says the group has long had a zero-tolerance policy for violence against healthcare workers, but she says she's looking for the province to do the same. Hamilton Health Sciences and St. Joseph's Hospital both were not available for an interview today. But HHS says back in 2019, they implemented a policy that would better identify patients that could potentially become violent, either physically or verbally. And Nicole, in the wake of the pandemic, they actually introduced that policy into the emergency care as well. Back to you.